Hello, I'm Dr. Daniel Farkas, and I'm here to talk to you today about antibiotic side effects and help that you can get. And we're going to be talking about assessing and correcting the damage that antibiotics can do to your health. Now, this information is not intended to diagnose, treat, or cure any disease or condition. Be sure to consult a licensed prescriber of your choice before altering any treatment regimen, and let's get started. So I just want you to know right away, for those of you that are suffering with antibiotic side effects that could have devastated your life, maybe bothering you just a little bit, or have you concerned about someone else, especially a child, I just want you to know right off the bat before I start explaining things that there is help available. You're not just stuck. There's plenty of help available, and we're going to talk to you about how to do that. So this is very common. You may feel isolated. You may be learning about this for yourself or someone else. You may have never heard of this. You may have heard of this in many cases. You may work in healthcare and may see this all the time. But I'll let you know that the prevalence of antibiotic injury is this, and this is from Cleveland Clinic. 1 out of every 5 visits to the emergency room is due to antibiotic reactions. Also, antibiotic reactions are the #1 cause of child emergency room visits, Cleveland Clinic. So this is what was supposed to happen. Pretty simple. They were supposed to give an antibiotic and it was supposed to save someone's life or stop a pesky infection and do something good. But unfortunately, this is what actually happens even under normal conditions. It causes a disruption of something we call the microbiome, and these are orally taken antibiotics. There are topical antibiotics, or a lot of different type of antibiotics. We're talking about the vast majority, which are oral ones that you take you go get a prescription, or you're administered a capsule, a tablet, some type of oral antibiotic that you take by mouth. And that gets into the digestive tract and affects something that's called the microbiome. And what the microbiome is this living micro ecosystem, this whole world of bacteria that live in the digestive system, that keep things balanced, that make it so that we can take our food, break it down into solid waste, and safely excrete it. There is so much that goes on in the microbiome that pertains to the immune system function, emotional and mental health, vitamin production, and science is still understanding about the microbiome, but I'll tell you what definitely happens. Every time you take an antibiotic, it disrupts the heck out of it. This microbiome, by definition, is the resilient yet sensitive population of bacteria living in and on humans, which influence the immune system. Most living things have a microbiome within them or on them, and like I say, it's resilient, but it's sensitive. It does not like an attack, and that's what an antibiotic course of treatment represents: the nuclear bomb approach to winning a war. That is, you drop a bomb on the battlefield and hope it kills all the bad guys and that somehow the good guys prevail. And in many cases, it does. So just understand that the intention is to save lives and hopefully make it so that you outlive the antibiotic attack and that the bad bacteria, virus, whatever it was inside you that they were trying to destroy is destroyed. But unfortunately, what can unfortunately happen is this, and typically does, death of crucial beneficial bacteria that live in that microbiome. This causes an opportunity for overgrowth of opportunistic bacteria, and one that's very common. A lot of people have heard of this one or they've had it. It's called C. diff or Clostridium difficile. Very, very common in hospital settings if you've had antibiotic treatment in hospital setting. Very, very, very common. And there are also fatal allergic reactions in men, women, and children, young and old. Common reactions would be skin reactions and autoimmune conditions where the immune system gets sent just haywire and it just unfortunately starts attacking normal healthy body tissues. Very commonly, a reactive arthritis, joint inflammation, and just pain, just miserable pain. Now, what do they do? Usually, well, the ordinary answers are sometimes to stop antibiotics, but sometimes it's to add more antibiotics. Maddening. Oftentimes steroids, which help to try to modulate the already irate, malfunctioning immune system. Pain medication for pain and all the problems that come along with pain medication and opioids and addiction. Just understand all of these all have side effects. All have side effects. There really is no ordinary solution. Once you disrupt the microbiome and there's a problem, there isn't a very clear-cut solution. There's just really not. Not ordinarily. But I said a few minutes ago that there'd be some good news, and I want to let you know that an extraordinary approach does exist, and it's accessible by virtually anyone with a problem, no matter where they are in the world. So in the field of alternative healthcare and what we call advanced healthcare, also known as functional medicine, functional health, functional treatment, advanced functional medicine, we say this, and this is my mantra in my practice. I'm a certified functional medicine practitioner. We say, don't guess, test. I want you to know that there are advanced stool testing procedures from a number of sources that are available. And when I say advanced, I mean advanced. It goes beyond ordinary testing that just looks for blood in stool, parasites in stool. There are advanced ways to break down and look at the stool in a way that just goes beyond the ordinary approach that can just try to determine what life-saving measure you may or may not need. And I want to show you an example of just a little bit of an advanced stool test. So on this advanced stool test page, what we can see along the top in the blue strip, it says normal bacteria flora. These are your friends. These are your allies. We can see in these test results that these allies are actually at very severely poor levels, bad levels, some high, some not, just not where they're supposed to be. This is massive malfunction, and this is what antibiotics can do. Yes, they can kill normal healthy bacteria, but they create chaos. And the second lower half of this page represents, you can see in blue, if you can read it, it says opportunistic bacteria. Look how wildly overgrown these sneaky bacteria are, and look at the effect they have on the healthy ones. This is the microbiome. Please understand that it's not a theory. Science understands and knows with certainty that bacteria have influence and power over the immune system. They communicate directly with the brain to help to control the immune system. And when you drop a nuclear bomb on them, this is what happens, just like it does on normal healthy people in a normal healthy town, city, or country. The good news is that treatment is possible once we have precision information. Number one, and this is a typical overview of a extraordinary approach to assessing what happened to someone that had a terrible, terrible response to antibiotic treatment. This is what alternative treatment looks like, or what I call effective treatment. Number one, precision probiotics using competitive bacteria and yeast according to test results. It is crucial. Don't guess, test. Get the right information about what bacteria are overgrown, what yeast are overgrown, then use competitive bacteria. Can you see the crucial need for testing and not guessing? Once the bad guys have been identified and have been attacked and are on the run, then number two, you can start the stair-step process of rebuilding of the healthy bacteria population. This can be restored. No matter how bad it is, it can be improved dramatically with the right assessment. Also, along the way, instead of steroids and all the other things, pain medications that cause terrible, terrible, terrible addictions, it's just crushing our nation and the world. I just want you to know that there are powerful yet natural anti-inflammatories such as turmeric and its useful form, curcumin. That's just one of many, many, many. It all just comes down to getting the right help. We have to avoid the insanity. The insanity is doing the same thing over and over and over again, going back to the same places over and over and over again and hoping to get different answers. We have to get outside the box and we have to get extraordinary help. So here's what you can do now. Just simply reconsider more antibiotic therapy for yourself, your loved one, whatever your concern is. If you're a healthcare provider, reconsider antibiotic therapy. Reach out for help. And I just want you to know that we are here to help you. We can help you or find help for you no matter where you live in the world. We can't help everybody. We help people virtually all over the country. We have people internationally who we help. But no matter where you are, let us just at least guide you towards someone close by you if we aren't able to help you with your problem. But I'm glad to say that we can help people virtually. We send and ship test kits all over the world regularly. No matter where you are, you can get help. If you want us to find you a provider nearby where you can sit down with them, we will help find that. We have a huge network of alternative doctors who have advanced training, advanced experience in this. Where can you go? Go to backtohealthnaturalsolutions.com, reach out to us, message us anytime. I'm Dr. Daniel Farkas. We have a trained staff of natural health care providers that will help to get you where you need to go. And just remember our mantra, don't guess, test. If you're suffering or someone you care about is suffering from an antibiotic reaction, don't give up. There is hope, there is help, just don't guess, test. I'm Dr. Daniel Farkas.